Dr. Queen. I'm the CEO and the main physician at Energize Health and Hormones. It's a clinic in Mill Valley that's just near the Ferrari dealership. I've been told that's what I should say. And I specialize in concierge primary care for both men and women. And if you're a woman on my concierge team, I also provide your menopause care and your pelvic exams. In addition, I do individual appointments on menopause consultations and weight loss and also men's health. My background is kind of a mix. I'm kind of a zebra when it comes to providers in that I have almost 30 years as a Western medicine physician. I started when I was like 12 studying. And then I have a master's in public health, and I've done a bunch of international health. I'm trained in functional medicine, so I use testing that also the naturopaths or acupuncturists other people use. And I'm one of only 3 physicians in Marin that are certified by the Menopause Society. So tonight, I was walking with Donna, and she's saying, "Oh, I can't understand my labs." And in addition, all my patients, this is one of their biggest questions, and what we collaborate on together in the office is understanding what your body and what your labs are telling you so you can prioritize your goals and decide what you want to do. So tonight I want to talk to you about your labs and about your tests. And one thing that happens is how many people get on their social media or from their friends or on, and when you're listening to radio in the car, about tests that you have to have, something you can't miss out on, and hormone tests, a bone scan, a blood test. How many of you have seen that stuff on social media? Yeah, and it's overwhelming, isn't it? Because they pay people to advertise, and you just don't know what you need and what you don't, and what's good for you and what's valid. So tonight I want to talk about not necessarily the list of the 100 best tests. I want to teach you a foundation for being able to evaluate tests today and tomorrow after you leave the room. Because as soon as I stop speaking, there's going to be new tests and new innovations. So you have to learn how to choose the tests that are going to meet your goals. So what are you getting blood tests for? Anybody, raise your hand. What does someone want to get a blood test for? Cholesterol. What else?
Just to understand anything I'm deficient in.
Okay, any like minerals, vitamins
Exactly.
that you're deficient in?
Yes.
Anyone else?
Blood sugar.
Blood sugar, so your metabolism and how your metabolism is working. CBC, so if you're anemic, your energy level. Vitamin D, great for bones, immune system.
Thyroid.
So, thyroid, great. What did you say? Mammograms, yeah, mammograms too. So we're doing all these tests, from what I hear from you, is that you want to create a workflow for yourself where you're going to expand your health span, right? You're going to live a longer life, but you're going to live it in a healthier way. And so when we think about that, we want to think about, in the United States right now, what is the CDC, what data do we have that are the obstacles to living a long health span if you're a woman in the United States? Does anyone know what women suffer from? What do they die from in the United States? Heart disease? Men. Falling is a good one. Falling. Okay, men. Alzheimer's, dementia, stroke, cancer. Okay, you guys are good. Okay, so for the CDC in 2021, those are the latest statistics. The morbidity and mortality for women is really based on cardiovascular disease being the #1 killer, right? So if you look to your right and look to your left, one of you is going to suffer from cardiovascular disease and possibly die from it later in life. So it's something that should be up the top of our list to expand our health span, right? It's about 695,000, and then all cancers together are the next thing that women suffer from, right, and die from. So that's, the top ones are lung, colon, and breast. This is every single cancer is not as potent a killer of US women as cardiovascular disease, okay? And then we have accidents or frailty, okay? And this is a little sign here that this year they also had COVID, because that was a year we had a lot of COVID cases. And then we have stroke, and we have chronic lung disease. So these are the things that you want to be thinking about to test for and to prevent so that you can live a longer, healthier life. Now, because we're talking among women, and because I'm a menopause specialist, I always think to myself, well, how does menopause fit into this? So in menopause, it's a transition where our ovaries are slowly decreasing their communication with the rest of our body. It doesn't necessarily stop, but our estrogen and progesterone decreases, and it affects every part of our body from our head to toes, because we have estrogen receptors everywhere. So that even our cardiovascular disease is affected by estrogen receptors, because estrogen is an anti-inflammatory and has a direct effect on our arterial walls. It can lead to plaque when we don't have it, and things of that sort. So one takeaway that I want you really to think about, besides thinking about what the obstacles are to your health span, is thinking that your menopause is not just about hormones, it's about your health span. Because we know that replacing the hormones can help with some things, like increasing your bone density and not having you lose bone density, but what it can't help you with is we haven't found that it'll help you with less cardiovascular disease, or less GI symptoms, or your GI biome, or with your dementia. So replacing the hormones is not going to affect that. So we have to use what we have in modern and alternative medicine and our lifestyles to work on those things that we know we lose. Clear?
Yeah.
So I like to divide it into three things when I think about tests. It's kind of simple, like, am I sick now? Am I getting sick? Is there something that's telling me something's not working right? And can I detect an early cancer? So when I look at, am I sick now? Who mentioned a CBC? You mentioned a CBC, so that's a good one. So when I go to the doctor, I want to make sure that I get a CBC. Because it's going to tell me my blood level, like my hematocrit and my hemoglobin, for things like fatigue, for things like my immune system. It's going to tell me if my white blood cell is elevated, to tell me whether or not I have an infection. It also, the differential or the type of white blood cells you have in your blood tells you if you have anything growing that could be an early blood cancer. We also want to know the size of our red blood cells, and we want to know our ferritin and B12, because these are the things that can cause different types of anemia. So for instance, if you have very large or a mean corpuscular volume in large red blood cells, that's going to tell you maybe you have a vitamin B deficiency, and that's why you want your B12 measured to try and figure out why you have anemia and how you can fix it. So then we go down, we want to go to your chemistry, or comprehensive panel. And there we want to check to see whether your kidneys or your liver are sick. So not only do we take things in on our body, but we eliminate the bad things, right? So our kidneys are one of the main things that filter out our blood. So we want to check that they're working correctly. So we have a BUN and creatinine in our comprehensive panel. And we also have a glomerular filtration rate. That's how our kidneys are filtering things through our blood. And we want to make sure those are working. We also want to check our livers. Has anyone ever heard of fatty liver disease or non-alcoholic fatty liver disease? So that's one of the things we're seeing more and more among women and among the general population. And what we want to do is we want to check two enzymes that your liver makes, AST and ALT, and we want to make sure that those are low, so that it shows that your liver is working appropriately and not accumulating fat. Because your liver is the other organ that's going to get rid of the toxins in your body. So you want to make sure that's healthy. By the way, anyone can ask a question on the way too. This is open conversation.
What does CBC mean?
CBC,
Complete blood count.
complete blood count, thank you. You just made me go, oh my God. Okay, complete blood count. you want to test your urine. And the reason why you want to test your urine is you want to know if you're pregnant. You want to know if you have an infection, right? You think that's funny? And you also want to test like your kidney function to see if there's protein in your urine. And then sometime in your life, you'd like to get a hepatitis C titer, just to make sure you don't have hepatitis C, because there are cures and medicines for it now. So if you have it, you can be cured from it and not have to suffer from it. So then I want to go to, am I getting sick? So these are the ones that I like concentrating the most with my patients. These are the ones where there's the opportunity to change things and change your course. And I just want to do a quick disclaimer while I'm here too, is that this is an appetizer program tonight, so I won't cover everything, but I'm open to lots of questions, and you can always text me at my office or write me questions too. The other thing is that I invited people to be here to talk about tests and give you the opportunity to have like the gallery test here. There's a phlebotomist for cancer screening. And I'm not going to make any money from these tests. I'm just going to pass my patient discount on to all of you so that you get a significant discount on all the prices if you're interested in signing up or doing those tonight. So the tests that we want to think about that we can change are the obstacles that we want to get over, right? So we want to see how we can prevent cardiovascular disease. So who knows some things about cardiovascular disease? What's the mechanism?
Oh, the mechanism?
Or anything.
Well, what I am learning from you is the genetic component of it.
Yeah.
I have to become more aware of. Is that what
Yes,
you're
yeah, no, that's one thing, yeah. So there's a genetic component to cardiovascular disease.
I've also learned that sugar plays a huge role in
Sugar
this, that
does
we
play a
normally
huge
not
role, yeah.
taught.
And cholesterol. So cardiovascular disease is basically the hoses that bring the blood to all your organs to keep them alive and give them oxygen and nutrients. So if those are blocked in any way, if the lumen is made smaller by plaques or by buildup, then you can't get the flow, you can't get the oxygen, those organs start to die and not do well. So how do you develop plaque in your arteries? What's plaque made out of? Does anyone know?
cholesterol?
Yeah, oh good,
Cholesterol.
who said that? Oh, look at that. She hangs around with me too much. So who knows what a cholesterol molecule is? A lot of people say cholesterol, and it's like, well, what's cholesterol? What is it? So cholesterol is a fat. And the reason why it has to be packaged in a lipoprotein, and why we're measuring all these low density lipoproteins, high density lipoproteins, is cholesterol can't float around in your blood freely because it's not water soluble, and so it would float to the top like oil and water. So you have to package it in a protein. So lipo is the fat, protein is the protein. So you'll see that the cholesterol is inside. You also have another form of fat called triglycerides inside, which is how you store extra carbohydrates. And then you have the proteins on the outside, so it can float through your blood vessels. And is all cholesterol bad?
No.
No. So your cholesterol is mostly made in your liver, and it's the major or a very important component of all your cell walls, also your hormones and other functioning organs, other functions in your body. So we need it. So it's made in the liver, and the LDL, the low density lipoprotein particles, take it to the places it needs to be. And then we have high density lipoprotein particles, and they take it back to the liver if there's excess and gets it out of your body. So we're concerned if we have too many of the LDL particles floating around in your bloodstream, they're going to bump into the walls and infiltrate them and create plaque and make the lumen smaller and decrease the amount of blood that's going through. They can even block the total lumen. So the goal is that we want just enough for our system to use the cholesterol and not too much that it sticks and makes plaques. So on every cholesterol, there's also proteins on the outside that we're learning about. So one of them is an ApoB. Has anyone heard of ApoB lipoprotein? So let's think of cholesterol particles like a car. So the proteins are the car, the apoprotein B is a license plate, and the cholesterol inside is your passenger. When you get your low density lipoprotein, your LDL cholesterol, what it is it's the total amount of cholesterol in everything. But what it doesn't tell you is how many cars it's in. Like, it tells you the total amount of passengers, but it doesn't tell you how many cars they've divided up into. The more cars you have, the more likely it is to bump into the walls and create plaques. So not only do you need to know your good cholesterol, which is the HDL, but you also need to know the total amount of your passengers, your LDL, but you need to know what type of cars they're in. And that's called the LDLP, or the LDL particles. And that's, you can see the difference here. Both of these people have an LDL-C of 115, right? So their total cholesterol, the total amount of their passengers is 115. Doesn't even matter the units. But this person, it's packaged only in 1, 2, 3, 4, 5, 6 cars, right? So those 6 cars are gonna go through your blood vessels and not be that dangerous. But let's say your 115 passengers are in this many cars, that's gonna cause a problem. So you not only wanna know what your cholesterol is, but you wanna know how many cars it's in, because this is gonna be the number that's gonna tell you if it's dangerous to you. So let me bring this. The ApoB is also a way that you can count the cars. So when you take an ApoB, that's the license plate on each of the cars. If that number is high, that means it's not good because you have too many cars on the highway and it's gonna create accidents and plaques. Is that kind of clear?
That's a great analogy.
If you start, I don't know if you said, what influences how many cars one has?
That's a good question. We're still trying to figure that out to some degree. So we know how to reduce the number of cars once you have them. So your cholesterol is due to your genetics, to your exercise, to your eating, right? So most of it is controlled by genetics, but you can move the needle a bit by controlling your exercise and controlling your diet. In addition, we have Western medicines that can control it too, but I won't go into too many treatments today. But one important point about cholesterol and treatments is that there's also a new protein on cholesterol that we're testing for that's called little lipoprotein A. And it doesn't look exactly like this. This is obviously my rendition of a cholesterol molecule, but it sticks out and winds around. And about 20% of people have little lipoprotein A. If you have that, that is an independent risk factor for cardiovascular disease. So you want to know that. You want to know what your little a or lipoprotein little a is. Because you have an increased risk independent of your total amount of cholesterol, independent of the number of cars you have an increased risk. And in addition, certain medicines won't work to reduce it and could even increase it.
What's the test?
It's called a little a or little lipoprotein A, LPA.
That's the
Okay.
test.
So I'm gonna go through these here. So you wanna know the triglycerides, which are the fats. You wanna know your high density lipoprotein, which is gonna be the good cholesterol that brings it back to the liver and gets rid of it. Because there are lifestyle things we can do and medicines we can do to increase that if you're low. You wanna know your LDL-C, which is your concentration or density, that's all the passengers. You wanna do your LDL-P, which is all your cars. You wanna do your ApoB, which is another way of measuring all the cars, that's measuring how many license plates there are. And you wanna do the little a, or the LPA. The other thing you wanna do is an HSCRP. It measures inflammation in your body. And a lot of new research is showing that inflammation is one of the key factors of cardiovascular disease as well. So you want your HSCRP to be low.
What's that
HSCRP.
It's not on the list.
HSCRP.
Oh, okay, sorry.
Sorry, I'll do slides next time and handouts. I was expecting more of like a fireside lecture. So the other thing is you don't want to forget the basics. You want to measure your blood pressure, because if your lumens are obstructed, it's going to raise your blood pressure, right? So blood pressure over 120 over 80, 120 over 70, you want to talk to your doctor about it. So it's a really easy test. Don't forget that one. Then you can see it gets complicated, right? So you have your blood pressure, you have your family history, you have the total number of passengers, the total number of the cars, whether or not you have a little a. So then you want to think about, how am I going to decide if I need treatment or not? Is something happening in my blood vessels? Are they already getting plaque? And so what you want to do then is you might want to consider a coronary artery calcium study. And we have one of the people here from Simon Med. They do coronary artery calcium studies. They're usually not covered by your insurance. They're about $135. It's a 15-minute CT scan. And what it measures is, do you have any hard plaque already in your arteries around your heart? Are you already starting to form plaque? And if you are, you want to talk to a cardiologist or a lipidologist and consider your risk. And
What test did you say that was?
coronary artery calcium scan. And you can raise, Simon Med, raise your hand. He's not my normal rep, so I'm sorry.
I'm Tim. Simon
It's
Med.
Tim from Simon Med.
Cardiac
So
calcium score.
uh,
They're 195.
they're 195. They also do them at Marin Health. They do that at all the major places. The sad part is they really won't cover them unless a cardiologist orders it, or you've already had a heart attack or have a suspicion. They're on a lot of the executive physicals that people get, and I think more women need it. I think they're very useful for me in my practice for weighing out this. So when a person comes into me and we talk about your cholesterol and avoiding cardiovascular disease, I make a plus-minus scale. And I put on one side your family history, and we talk about your diet, we talk about your exercise, your a little lipoprotein A, and then you have to together decide what your risk is. There's also a risk scale called ASCVD that was developed around 2013. So it doesn't have some of these factors on it, but it tells you how much your risk is increased. And you have to balance all those things. There's no right answer. Like, you do not have the same treatment as you. But you need to know that these are the tests you need to consider getting past this obstacle. So are there questions on that one? Yep.
Just a quick question about
Low blood pressure.
Yeah. Is that a
A cause
cause for concern? Like,
for concern. Only if you're fainting. Low blood pressure is a problem if you're symptomatic, which means that you're not getting enough blood to your brain or your arms or your extremities or your organs, because it would be just the same effect as having plaques, right? When you don't have the blood getting where it is, then those organs and tissues start to die or not function properly. So if you have low blood pressure of 85 over 50, and you're walking around and doing everything fine, then it's not a problem. If you're having memory problems, you're having strokes, you're having chest pain, then it's a problem. It's a plumbing problem.
I have a question.
Oh, go ahead.
Yeah, on little a, my understanding is there's a hereditary
Yes.
component on that.
Yeah.
Is there any treatment for that?
No. Okay. So we're not going to talk a lot about treatments, but I'll say little LPA
Yeah.
is 80 to 90% genetic.
Yeah.
It's not something you can change. They have developed a new medicine called Repatha, which is a PCSK9 inhibitor that you can use as an injection. And in addition, within the next 5 to 6 months, they're going to come out with a bunch of mRNA targeted medicines for that cholesterol problem as well. So the field is growing astronomically, and there's going to be more opportunities to lower your risk based on that, but you don't want to use a statin with that because it can increase it. So.
Thank you.
So let's go to metabolism now. Are you guys bored, asleep yet, or is this okay?
No,
Is this
great.
what you wanted?
Great.
Okay.
Yeah.
All right. So, metabolism. So, how would somebody define your metabolism? When you take your blood sugar, okay.
How efficiently your body
Right. Yeah,
processes
exactly.
nutrients.
So you take in all this food and it goes into your bloodstream and you somehow have to make it into good energy. So good energy is when a cell opens up, puts the sugar and the carbohydrates, everything in it, and makes it into ATP. And I'm very sorry for the PhDs here. These are incredibly simplistic explanations, but they work. And what opens up the cells? Does anyone know what opens the cells to let all that sugar and food in to make good ATP? Good. Who said insulin? Great. Okay. Oh, another reason. So your insulin opens up the cells to let all the sugar and glucose go inside and become good energy. When you have too much glucose in your blood, like you're eating the standard American diet and it's just way too much, it overwhelms the cell. The other thing is if your insulin isn't working well, you can get insulin resistance as well. So what you want is you want the optimum system where the sugar is going from your blood vessels into your cell, making ATP, which is good energy for your brain to work and your heart to work and everything else. If this doesn't happen, it's going to go to your liver and it's going to make a fatty liver and make fat, and it's going to cause you cardiovascular disease and diabetes and all the things we don't like looking at in the mirror. So when you're talking about your metabolism, we want to test it in a couple ways. I want to see, if you're my patient, I want to see your metabolism today. I want to see you fasting, and I want to see what your fasting glucose is. I want to see if you still have a lot of glucose in your blood after you've had time to process it. I want to see your fasting insulin, because if your cells aren't opening up, your body's going to start producing more insulin and keep on saying cells open, open, open. And that's going to tell me your system's not working well either. And then I want to see something called your HbA1c. So this is hemoglobin A1c. Have people heard of this? Yeah. So your blood cells last or live for about 90 to 120 days. And as they're floating through your blood cells, they collect glucose. Glucose sticks to them that you've eaten. So if I take a red blood cell out, it's going to have all this glucose on it from the past 3 months. And it's going to tell me how efficient your metabolism has been. Because if it's covered in glucose, that means your cells have not been opening up to produce the glucose that it's been sticking in your blood vessels. If your red blood cells have no glucose on it, that means your metabolism has been better. So we want to have that number. That's the number that's like between 5 and 7 that you hear about. So you want that number, and that's a good number to follow as well. So another part of your metabolism that I like to check on is your thyroid, because that has a lot to do with your energy and how fast you metabolize things. So you want to be able to check both your thyroid stimulating hormone, which comes from your pituitary hypothalamus and tells your thyroid, get going, and make some thyroid, but you also want to check the thyroid hormones, so T4 and T3, to make sure you have those. And then one thing that happens with women in menopause is that we find that your autoimmune system can go wacky, or things that were wrong with it before can become magnified. And so you want to test, has anyone heard of Hashimoto's disease? Mm-hmm. Okay. So you can develop or have in your body antibodies to your thyroid. So even though the system is saying make thyroid and you're making thyroid, there's an antibody that you have that's attacking your thyroid and slowly eating up your thyroid tissue. So you want to be tested for that at least once. Because around this time, I mean, the typical menopause complaint is, I just don't feel like myself. I don't have the energy, I don't have what I had before. And one of those things is you can't all chalk everything up to just adding an estrogen. You have to think about other things too. So that's your metabolism.
Question about thyroid. Why is it that most, in the standard medical practice, they really just test for
TSH.
and
maybe
really
T.
will say there's no reason to. I've just heard that a lot.
Yeah. There's a big difference between what's economically feasible for an organization and will create profit, what is good for a public health measure that can catch 95% of the people, and what's good for you. So there's always this conflict. I like to test the whole cycle, because possibly you could have Hashimoto's antibodies, and you could just be at a slightly low level. So your TSH could be at the higher range and be saying, let's say at your baseline, okay, this goes a little bit to, I'm gonna draw a little bit. So when you take a test, right, it's based on a certain population. In this population, they decide what's normal by a bell curve, right? You're familiar with this, with the 5% here, 5% here, 50%. And usually this is what you call the abnormal range out here. Well, let's say if before, when you were 20, your TSH was here. And now you're 45, and your TSH is here. That's a big change for you, but that's still normal for everybody else, right? So if I don't test your T4 and T3 there, I don't know that this could possibly be your thyroid stimulating hormone being really reactive because your thyroid's not working and the feedback mechanism's coming back. So especially with women who are having fatigue or mood changes, I like to check that. Not to say that I catch people like it's 100% of the time that I catch something. It's not. But you know, if you're limited in your price, or if you're working with Kaiser, I'll tell you what I think you can get, and then we can decide together what the benefit of the other things are for you. But this is why I like to test it. Does that make sense?
Yeah, that's the point.
Okay, so let's go to the next one, which is fragility. So who thinks about their bones? Okay, how many people have had a DEXA scan? So fragility has to do with the fact that as we go through menopause and our estrogen progesterone decreases, both the density of our bones and the structure of our bones can change. So let's have, I'm gonna count 10 people. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You guys stand up. So we have about 60 people in the room. So before the end of our life, these 10 women, so 1 in 6 women are gonna get a broken hip. Okay, let's have you 3 sit down. 3 of them.
We have broken hips.
Broken hips. Did you break your hip and you had to sit down?
Yeah.
But you died from it.
Oh.
30% of the women will die from it.
Jeez.
So let's have another 2 people sit down. You 2 sit down.
But what did they die from?
They didn't die. They didn't die. But 50% of the people, of the women who break their hips, are never going to gain their independence again. And their life is going to be changed forever. So these 5 women are going to be okay after breaking their hip. So we either want to be one of the women in the audience now who's sitting down who wasn't among the first 10 that never gets the fracture, or one of these women that got the fracture and got better, right? Right, you can sit down. So how do we do that?
Can we bring them back to life?
You're back to life.
Thank you.
Thank you.
Yeah, exactly. And you're all walking. You're counting your steps.
Well, we never had a broken hip in the first place.
Yes.
Because you're listening to this lecture.
Yeah. So what you want is you want to have the right nutrients so that you build bone and keep your bone. So you want to get your vitamin D tested. You want to get your calcium and your magnesium tested. Those are the things you need to build bone and to keep your bone. Okay? Then I want to talk about something that because I'm in functional medicine and I think more of lifestyle, I tend to think that skeletal muscle mass is also very important to measure. Because if you have strong bones or weak bones, if you have enough skeletal muscle mass, it's going to help support your bones and make you stable so you don't fall. It's not something that's usually measured in a doctor's office. I have an in-body scan. Some people get it done at their gyms. I won't be able to go through the whole thing with you, but this is a printout that you get. And what you want to be looking at is that you can see here that you have skeletal muscle mass. And you want this to be within the normal range, which on this type of test is here. And you can see that this woman's range of skeletal muscle mass is low. And if you have this, you want to be tracking it, and you want to be doing resistance training, and you want to increase your skeletal muscle mass. And there's a couple reasons. One, using your muscles leads to less dementia. Two, it leads to less fragility fractures and falling. Three, as you get older, even though skeletal muscle mass is not the most active organ in your body, it's one of the largest organs, so it helps to keep your metabolism in control. So what's going to happen is that as you get older, your muscles are going to be the things that chew up all that glucose and make the good energy for you and keep you from going down the path of diabetes and cardiovascular disease. So this is a measurement that I think is worth having and is worth paying attention to and tracking, and something we can all do something about. You can also see your percent body fat. You can see where the skeletal muscle mass is distributed. There's also a measure of your visceral fat, because we have different fats in our body, where the fat on the outside that we all don't like and we see is not as metabolically active. It's not as dangerous. It's the fat around our liver, around our heart, around our organs that's gonna make us get cardiovascular disease, make us get diabetes, make us die earlier. So what you wanna do is you wanna get this number below 100 on this test. I think any test is good, but I think that you should be thinking about your skeletal muscle mass and thinking about resistance training. Yeah, go ahead. No, go.
I'm curious about the DEXA scan.
Yeah.
And there's the trucks that go around and you can pay for a DEXA scan. Is that the same DEXA scan that you would get if you were having your bone scanned by a doctor?
Okay, no. But let's talk about it. That doesn't mean it's a bad thing. Like everyone has a range of things they want to do, what's available to them, and how to track. So let's talk about bone density now. The scan, just so we keep in the back of our mind, those trucks that go around do measure our muscle mass as well. So that's an advantage of them. So let's talk about bone density. So there's two things right now, but there's going to be more factors as people doing more research. One is the density of your bones, right? Oh gosh, what is that game where you have the wood and you take, what is it called? Jenga. Okay. The other one is like Jenga, thank you, where you're like taking out things, but if the structure is enough, even if you lose the density, it's not gonna fall. So do you understand the difference? They're two totally different concepts. So when you get a DEXA scan from a hospital, it's an X-ray, so it's equivalent to radiation of like being on an airplane for a short flight. And it gives you a T-score. And that is what tells you your density of your bone. There are some hospitals, Marin Health does not, also give you a TBS score, a trabecular bone score, which is basically the architecture of your score. That you can get with Simon Med, and I'm a fan of getting that, because even if you have low bone density, you might have high trabecular structure, and you might not want to consider a medication to be on. There are two types of medications. We're not going to go over treatment. I can talk about that in another time. But there's either treatments to keep the bone or treatment to build the bone, right? But if you have a high trabecular score and a low density score, you may not want to take the side effects of the medicines or do it. So you have to have all the data. There's another interest, mostly also I want to say DEXA scans are not covered by insurance usually until after you're 65, unless you've had fragility fractures or very strong family history, and even then they're probably not considered. The two places that I like getting them because they're reasonable for cash only prices are Simon Med. Remind me how much the scan is? It's $350 I think. $395. $335 for a DEXA scan with a TBS. I'm trying to convince them to bring a unit up here to Marin because they don't have one, so you have to go into the city for it, but that's one of the places. I do not make any money off of them. The other thing that's very exciting is there's a new way to measure bone density that isn't really new. It's been probably as old as the DEXA scans, but it's without radiation and it's using ultrasound. Everyone knows ultrasound waves. So it was developed in Italy and it's FDA approved, but it's not a standard of care. So even though research has shown that it's comparable to DEXA scans, I wouldn't use it as comparing a DEXA scan to a REMS, to the ultrasound scan. But I would certainly use it as a tool to help you, because maybe you don't want to go and get radiation again and again. So it has not a trabecular bone scale, which the TBS scale on a DEXA scan is based on the little pixelated gray units that they get on the x-ray, and it's a computer calculation. On the REMS ultrasound, it's actually based on ultrasonic waves off the structure, and then they base it on how likely your structure matches other women who have had fractures, haven't had fractures, and in the middle. So they're both great ways that you can measure your bone density, and it's something you should know. Because does anyone know things that help bone density?
Exercise,
Weight training.
Weight training, anything else?
Jumping.
Jumping is kind of like weight training.
Calcium.
What was that?
Prunes, I heard.
Prunes? That one I'll have to look up. I don't know, I guess that's who you want to keep company with, maybe? I don't know. Is that vitamin D, so adding vitamin D? But then what's, one of the, calcium, but one of the only FDA approved indications for using estrogen as a preventative measure is low bone density. So if you have low bone density, or you're starting to lose your bone density during menopause, you want to be on an estrogen patch if there aren't other contraindications. It's a complicated thing, but you only have to be on a very small dose, like not even as much as the smallest patch, for it to actually make it so that you don't lose your bone density during that period of time. And during menopause, you can lose 1 to 2% of your bone mass a year, right? So if we're in menopause for 30 years, that's like 30 to 60% of your bone mass that you lose.
Sorry, just to go back to when you were holding up the in-body scan, you said as long as it's under 100. What was the number what was that?
Oh, that's just on that brand. So I have an in-body. So what you want to ask is what is your visceral fat level? So if you use a different brand, they might have a different way of measuring it. You want to know, what is my skeletal muscle mass compared to other women of my height? You want to know what your visceral fat is. Okay.
Can we hold questions till after?
Okay, yes,
Because
I've been
they're
told.
running
Okay.
late.
Oh, we're running late? Okay, I can stop
No,
anytime.
keep
too.
going.
Okay, I'll try and hurry up. So then, the last thing I look at is like homeostasis and inflammation. And has anyone heard of their gut biome?
Yes.
Yeah. So as your estrogen decreases, your gut biome changes. This is more of a functional medicine type of evaluation. But it detects inflammation, it detects your dysbiosis or the mix of the bacteria in your gut, and it also can measure digestion. So are you missing enzymes? Do you have H. pylori? And it can tell you different measures. Oh, before I leave the bone density, both types of DEXA scans, the DEXA and the REMS, are here tonight for you to talk to and get the pricing and appointment type things. Also, Genova is here, Carrie is here, where's Carrie? With the GI tests and the cortisol studies, if you're interested in learning more. And you get my patient discounts. So this is a good thing to do to determine whether or not you have inflammation in your body and how you're processing everything you eat. So I like this.
What is the name of it at the top?
Oh, it's homeostasis or decreasing inflammation.
Okay, but right.
So it's a stool test.
Oh, it's a stool
And
test,
it's
okay.
Genova is the company I usually use. There are other companies, but I like this one especially because they use PCR as well as just looking at it underneath the microscope. The other thing that I use to teach patients more about your inflammation is to do your salivary cortisol levels. And this is because as women, we're all like, oh yeah, I'm stressed, or oh yeah, I don't sleep, and then when you do your levels and you see where your cortisol levels are, sometimes that's a reminder to you of how you have to change your lifestyle and what you have to do. So your cortisol is supposed to have a morning awakening period, and then it goes down like a hockey stick. So I won't talk much about that because I want to quickly get to cancer. So I promise I will be very quick with cancer. So cancer, do I have early cancer? What I don't want you to forget to do is I don't want you to forget to do the things that are proven, right? There's some things that are not much fun, but we need to do them. Cervical cancer screening, you need to do that from 30 to 65, every 3 to 5 years. Make sure your pap smear has HPV on it. Colon cancer is a big killer of women and something that we can cure. 45 to 75, you can do, it's a little bit, you can have different choices, but there's colonoscopy where they actually see your colon. There's also a stool DNA kit where they test for DNA of colon cancer, and a FIT test where they test for blood. Breast cancer, we all know the deal with that. Right now it's mammograms. Hopefully one day it's going to be something better. So then let's talk about some really exciting things that we have available to us. So let's talk about genes. Now this is like coming out of everywhere. You see genes and proteomes and multi-cancer detection tests. So what you can do is you can test, this is a DNA. Your DNA makes proteins that you use in your body. You can test your DNA with genetic tests like the BRCA test, like the MSCPA test, to see whether or not you have DNA that can make this bad protein. That's not your destiny. It doesn't mean that that gene is going to turn on or it is going to turn on. The test won't tell you that. Another test we have is Jason. There's Jason back there, and he's from Grail. This is called a multi-cancer detection test. And basically, when you have cancer, it's very fast-growing cells. And when you use the DNA to make lots of proteins, it gets methylated. So this takes your blood and sifts it out for methylated DNA and says, I think you have a cancer. And then it takes that DNA and matches it to the part of your body and says, this highly methylated DNA is from the liver. And then your doctor's going to say, we need to look at your liver to see if you have cancer. And it's it has good sensitivity and specificity, and in addition, it has very good record of identifying where the fast-growing cells are from, and you do it about once a year. They recommend starting from 50. You can do it at a younger age if you want. And they're here as well with my discount if you're interested, and again, I don't make money from them. Then we're going to have a talk in 1 second. I'll just give you the real, like, cookie cutter, brownie, simplistic proteomes. So once your DNA starts producing, it's going to make a protein, right? But it's going to make all these different proteins from one DNA. It can make thousands and thousands of proteins from the same DNA. So in your body, you have all these proteins. And if we can identify all of them, and then put them through an AI system to say which ones are causing aging, which ones are causing a disease, which ones are actually gonna respond to a drug that we're gonna give you, then we would have this magic recipe just for you. So this is what we're gonna be talking about. And in addition to putting all this information about proteins into the AI system, they're also working on scoring systems where they can put things like the state of your microbiome in there, like how much you exercise, what your gender is. So this is exciting because it can offer us advances in aging, cancer detection, disease detection, and new and better drugs are just a couple of the things. Okay, I think that is the end of my talk. Remember that you have the power to make a difference with your health, and that menopause is not just about hormones, it's about your health span.
We will have a Q&A after Dr.